Hi, everybody. I'm Dr. Brian Artis. This is the Dr. Artis Show. I hope you've had a great week and a great weekend that just went by. This is going to be an incredible show. This is all going to be about how to eat, how to eat. That's funny. How to beat blood and bleeding disorders. This happens to be March of 2024, and the CDC wants you to know this is March. And March on the 12-month calendar is Blood Disorder Awareness Month. All right, so I have an entire presentation of everything you need to know about beating blood disorders all naturally. That's what's coming up. So anybody you know that has anemia or any other kind of weird sickle cell anemia, kind of bleeding disorder, this show is for them. I'm going to show you all the stuff that's published on cures for those things and how to prevent them, slow down its progression, or reverse it altogether. So that's going to be very exciting. I hope you guys are ready for it because it's going to come up right after this commercial break. Don't go anywhere. I don't do this stuff for nothing. All right, we'll see you in a minute. All right, everybody. Welcome back to the Dr. Artis Show. I'm your host, Dr. Brian Artis, and this show is all about blood and bleeding disorders. Why? Because you don't need them. And just so you know, you probably don't need MDs either to drug you for your bleeding disorder or blood disorder, no matter what they've told you. Even if they told you it's a genetic thing. I'm going to actually take you through what is published as natural cures for all bleeding disorders and blood disorders, like anemia, sickle cell anemia. It's going to be great. All right, so who's bringing this show to you? I am. healingfortheages.com. If you missed our virtual conference just last weekend, I'm sorry. Go back to Healing for the Ages and go watch it. All right. So healingfortheages.com. This is a conference I created in September. Go subscribe to the newsletter. And if you haven't watched the presentations from last September, go download them all. You need them to be ready for our September coming up, Healing for the Ages 2.0 conference. All right, good. Outside of that, Hydro Shot. Go to h2bev.com. Put in the discount code DOCTOR, and you'll save 10% off of your Hydro Shot drinks. I drink them every day, sometimes twice a day. Gives me 8 hours of energy with nitric oxide infused with hydrogen. It's an amazing product. I love it. I've been using it for years. Thank you, Kurt Rutman and Hydro Shot. Y'all did a great job. Go to h2bev.com to learn more. You want a discount on it? Put in my last name, ARDIS, or the word doctor. Either one of those should generate the discount for you, which is great. MyPillow.com, put in the promo code DOCTOR. You can actually get discounts and additional discounts on anything at MyPillow.com or at his new MyStore.com also. Also want to let you know that this is going to be brought to you by my Cardio Flow product at the Dr. Artis Show. And you're about to learn why, right? Cardio, heart, cardio, flow. Flow is the blood flow going through the body. This is a blood disorders presentation. All right, let's get into it. As you know, this presentation has the video. At the drardisnishow.com under patient resources is the entire PDF that includes every slide from this presentation I'm about to show you if you're watching this. If you're driving, listening, wherever, at your leisure, just make sure if you need information, you feel like you need to pull over and take a note or you need to write it down, you don't. It's all at the Dr. Artis Show for free underneath patient resources. Click it and then send it to anybody you know who has blood disorders. Maybe they need this info. You should see it on screen. Blood/bleeding disorders 101. All right, March is Bleeding Disorders Awareness Month. Just want to make sure you know this is what the CDC, the NIH, HHS, FDA, all of them want you to know. It is Bleeding Disorders Awareness Month. All right, so let's set some expectations here. What are blood disorders? Blood disorders are conditions that keep parts of your blood from doing their jobs. For example, your red blood cells carry oxygen throughout their body. So if there's a problem with the red blood cells carrying oxygen throughout your body, you have a blood disorder. Your white blood cells help protect your body from infection. So if there's a problem with the white blood cells, picture leukemia or something like that, that is a blood disorder. Your platelets help your body to clot so you don't bleed more than normal. So if you have a problem with clotting, overclotting, not clotting, blood's too thin, that's a platelet blood disorder. All right. What are common bleeding disorders? Bleeding disorders happen when your blood doesn't clot normally, causing you to bleed more than usual. Bleeding disorders include Van Willebrand disease. For those of you who don't know what that is, there's the definition. It's a condition. This condition is the most common bleeding disorder in the United States. And most people who have von Willebrand disease inherited a mutated gene from one of their biological parents. And some of these people have complications of cancers, autoimmune disease, and heart and blood vessel diseases. I hope all those individuals are fans of the Dr. Artis Show because we can teach you how to manage that stuff. Also, inherited hemophilia. This rare genetic condition may make you bleed more than usual. Thrombocytopenia, which is a huge problem with COVID, and after getting vaccinated. Thrombocytopenia. This condition happens when you have a low platelet count, immune thrombocytopenia, the immune system doing it, and thrombotic blood clotting, thrombocytopenia purpura, are examples of diseases that cause thrombocytopenia. Another blood disorder is fibrinogen deficiency conditions. Fibrinogen is required to make blood clots. So fibrinogen is another protein that helps your blood clot. If you don't have enough of it or the fibrinogen doesn't work as it should, you may have abnormal bleeding or clotting issues. What are common disorders of blood clotting conditions? Prothrombin gene mutation, antiphospholipid syndrome, protein S deficiency, protein C deficiency, antithrombin deficiency, not able to make a clot, peroxisomal nocturnal hemoglobinuria. Who knows what that means other than it happens at night? Isn't that funny? And then disseminated intravascular coagulation. These are micro little blood clots throughout the body that led to all your COVID toes, COVID fingers scenario where your fingers and toes turn black and then you have to cut them off. Little bitty blood vessels are full of blood clots and those tissues die. Now, if any of y'all know anybody who has these conditions, which I do not personally, but if somebody you know has these conditions, this show is for them. So please share this with them. All right, common bleeding disorders, symptoms. This is how you would know you possibly have a blood clotting disorder. Number 1, nosebleeds. Number 2, excessive bleeding. Number 3, internal bleeding. Bruises, bruising that happens for no apparent reason. You know, all these people with Coumadin and blood thinners who have all this bruising all over the body, you have a bleeding disorder. Heavy periods, menstrual bleeding, heavy bleeding after childbirth or miscarriage, blood in your poop or stool. If you see black blood in your stool, you have a high, way up high in your digestive tract, you have a bleed. If it's red, it's closer to your anus. Blood in your urine. Talk to your doctor if you have blood in your urine. These are all signs that you have a bleeding disorder. To kick off the relevance in the media, I wanted you guys to know that they are talking right now in the last 3 or 4 months about a new world's first gene therapy for 2 blood disorders, sickle cell anemia and thalassemia, has been approved. Casgevy, the first medicine licensed using the gene editing tool CRISPR. All right, so all of you, CRISP, CRISP, stands for cysteine-rich secretory proteins that come from snake venom. So they are using more snake venom now to tell you should use snake venom gene editing therapy. Venom cleaves to and cuts RNA, DNA. They're now making COVID type mRNA gene therapy vaccines and drugs for sickle cell and thalassemia. Everything's going to go to CRISPR and new gene therapy. All right, NBC News says a new gene therapy could be a game changer for patients with severe anemia. Anemia is low iron in the blood. The cost is $2.8 million. How many of you could afford $2.8 million for a drug to help you with your anemia? We're going to teach you about anemia. Just so you know, anemia, number 1 caused by copper deficiency. You do not need a drug that costs $2.8 billion or $2.8 million. You just need copper that might cost you $50 a month, and you're going to be fine. So ridiculous. All right, so that's in the news right now. The World Health Organization is calling for, this is last year, the World Health Organization is calling for accelerated action to reduce anemia, low iron. Let's read the blue highlighted parts. Anemia is a serious global public health problem affecting 571 million women and 269 million young children worldwide. All right, get that number. 571 million plus 269 million is almost a billion people. That's almost 15 to 17% of the entire world's population have anemia, low iron. They all have one thing in common. They're deficient in copper. All right, in 2019, anemia affected 40% of children between 6 months and 5 years of age because their mom's deficient in copper and eating glyphosate in their processed food. 37% of pregnant women and 30% of women 15 to 49 of age. It is most prevalent in low and middle income countries. Anemia increases the risk of infections and death, impairs cognitive performance, that's all lack of copper, and causes extreme fatigue because copper makes ATP. Poor pregnancy outcomes, that's awful. Loss of earnings and poor growth and development. It's a strong indicator of overall health. Now, what are they using to treat this stuff? All right, let's show you the first drug they're using to treat blood disorders. First drug we're going to talk about is warfarin. All of y'all have probably heard of warfarin. Let's go over some of its side effects. Let's look at their mild and serious side effects. Mild's on the left of the screen. Minor bleeding or bruising, nausea and vomiting, diarrhea, gas and bloating, taste changes. Oh, don't you remember that during COVID? Taste changes, chills, itchy skin. Serious warfarin side effects include severe bleeding, tissue death. That means cells in your body are going to die from warfarin. All right. Severe bleeding, tissue death. That means muscle, skin, ligaments, tendons will die if you swallow warfarin. Calciphylaxis, calcium deposits in your blood vessel. Oh my God. Haven't you heard of like these Doppler carotid arteries in your neck scans they do to see if your arteries are calcifying? Did you all know that warfarin does that? I didn't until I was preparing this actual presentation. All right. So, all of you that have Dopplers done, all of you who are having calcium test run on ultrasound on your neck, and they say you have calcium in your blood or in your blood vessels, that is a side effect of warfarin. You need to get off of that. And if they tell you need warfarin, that actually causes it. Kidney damage or failure is another published serious side effect of warfarin. Vasculitis is inflamed blood vessels, and hair loss. Not sure many men or women want to have hair loss due to warfarin, but just so you know, losing your hair means you've been poisoned. Remember, when people go through chemotherapy, what happens? One of the very first things, all their hair falls out. Hair falling out is a symptom of being poisoned. Warfarin is poison. All right. The next drug that they use primarily for blood disorders is heparin. Heparin may cause you to bleed more easily, they say, which can be severe or life-threatening. Oh my God, why would you use this for a bleeding disorder if heparin causes you to bleed more easily? So ridiculous. All right, this is off of drugs.com. Did you know heparin causes you to have a more life-threatening bleeding episode? Oh my gosh. All right. You might see discoloration in your skin, they write. Irregular heartbeats and chest pain from heparin. Heparin also causes shortness of breath, dizziness. Who doesn't want to be more dizzy? Anxiety, sweating, any unusual bleeding. Report to your doctor if you have severe pain or swelling in your stomach, lower back, or groin. Everybody wants groin pain from the drug they're swallowing or injecting. Dark or blue-colored skin on your hands or feet. That means you have cyanide gas in your body. You are dying. Just so you know. Nausea, vomiting, loss of appetite, unusual tiredness, any bleeding that will not stop is a side effect of heparin. Nosebleed, blood in your urine or stools, black or tarry stools, coughing up blood or vomiting that looks like coffee grounds. Side effect of heparin. Heparin can cause you to have bleeding episodes while you're using it and for several weeks after you stop using it. So even if you stop it, people, and you're still bleeding, just know it takes several weeks for this crap to get out of your body. Bleeding may be more likely in older adults. Are you listening, older adults? Especially women over 60 years of age. Stop using this medicine and call your doctor at once. If your skin changes where the medicine was injected, fever, chills, runny nose, or watery eyes happen, easy bruising, unusual bleeding, purple or red spots under your skin, signs of a blood clot, call your doctor immediately because heparin can cause blood clots. Sudden numbness or weakness in your body, problems with vision or speech, swelling or redness in an arm or leg are all signs you have a blood clot, and heparin can do that to you. Common heparin side effects also include bleeding or bruising, uncontrolled bleeding, allergic reactions, or abnormal liver function tests. That means liver toxicity. Ask your doctor if liver toxicity, dizziness, death is right for you. Desmopressin acetate tablets is the next drug they use for blood disorders. Side effects that you should report to your doctor immediately include breathing problems. The drug, again, is called desmopressin. Breathing problems, chest pain and tightness, changes in your blood pressure, irregular heartbeat, flushing of your skin, headache, drowsiness, dizziness, confusion, vomiting, muscle cramps, restlessness, seizures. Oh my God, did y'all know that causes seizures? Sudden weight gain, swelling of the legs or ankles, unusual weak or tired, dry mouth, headaches, mild nausea. Sounds great. The next drug we want to make you aware of is Hemlibra. Hemlibra is another blood disorder drug that are often prescribed. Did you know this serious side effects of this drug called Hemlibra, hem meaning blood in Latin, hem. These serious, or maybe him means iron, actually. Sorry, I might have screwed that up. All right. These serious side effects include thrombotic blood clotting, microangiopathy. Angiopathy. Y'all know what that means? Micro blood clotting. It's a condition involving blood clots and injury to small blood vessels that may cause harm to your kidneys, brain, and other organs. Okay, that's a side effect of Hemlibra. Also, they published that this blood disorder drug also causes blood clots that lead to strokes, which may form in blood vessels in your arm, legs, lung, or head to cause a stroke. Call your doctor at once if you're experiencing while on Hemlibra stomach, chest pain, confusion, weakness, nausea, vomiting, swelling, pain or redness, feeling sick or faint, decreased urination, can't pee, yellowing or yellowing of skin and eyes. That's jaundice, liver failure. Let your doctor know if Hemlibra while you're on it is creating eye pain, swelling or trouble seeing, fast heart rate, numbness in your face, headache, shortness of breath, coughing up blood. All right. Let's talk about inherited anemias. This slide may be out of order, but there are inherited anemias. Anemia means lack of iron. So let's talk about these blood disorders related to anemias. That include sickle cell anemia, Fanconi or Fanconi anemia, diamond black fan anemia, and thalassemia. So you can read those. They're on the screen. Thalassemia is pretty common. In thalassemia, your body produces less hemoglobin, resulting in small red blood cells, and they can't hold iron.